Good evening, good afternoon, and good morning. This is the 1419th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. Poonam Chablani. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, that International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors, and was formed at the time of COVID. And we have doctors and eminent personalities from 65 countries presented various papers on this forum. And all the papers were really excellent and informative as well as educative. And we have a lot of presentations every day. We have 3 sessions every day. The first session is already over from 7 to 8, the Hindi session, and 8 to 9, the international session in English, and 9 to 10, local language session in Malayalam. Let us go back to our guest. Dr. Poonam Chablani is the guest of the day, and she has completed BHMS, PGNIHFW, PGDMH, NDDY, and she is a REIKI Grandmaster. She has more than 30 years of clinical experience, and she is having teleconsultation also. She is having lot of activities. She is the director of homeopathic science cardiology of homeopathic cardiologist of India and HCL under guidance of founder Padma Shri awardee late Dr. K.K. Agarwal, President HFC and Heart Care Foundation of India, ex-IMA President, and he is a cardiologist. Part of her career of many cardiologists, she was a part of many cardiology camps with the HCFC, where patients were prescribed homeopathic medicine had a notable outcome and result. That is the most important aspect of her participation with this cardiology society, and organized many camps and at Rotary and Lions Association. She is the executive member of NHMC, alumni life member of SDHA and HMAI KHA volunteer. She is a guest speaker to many homeopathy conferences, online and offline. She has won many awards: Board of Homeopathic System of Medicine, Dr. Jugal Kishore Award, Dr. Hanuman Award, Appreciation Award, Homeopathic Association National Excellence Award by SCFC, and Health. She has won another award from Health Minister Shepherd Naik on World Homeopathic Day and on 9th to 10th April 2016 at International Conference of LMHI Vijnan Bhavan, Chikitsa Seva Puraskar also. She has written a lot of articles in various leading newspapers, particularly the Hindustan Times and Mail Today. Yoga brought respect to asthmatic patients and insomnia, pollution, and asthma. Like that, so many articles were written by Dr. Poonam Chablani. So today, Doctor will be discussing one of the very important subjects, the liver and biliary diseases and homeopathy. As you know, this is one of the commonest problem nowadays. A lot of people suffer from these liver and biliary disease problems. So let us proudly welcome Dr. Poonam Chablani to this session. Welcome, madam.
Thank you, sir. Can you hear me?
Yes, yes.
Can I start my session, sir?
Yes, 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 definitely. You can go ahead with your presentation. Doctor, 1 minute. Today, we need have a 1 minute silent prayer for the departed one of our eminent personality, Dr. Shaji Kudiyat's mother was expired yesterday. So we have to say make a 1 minute silent prayer for the beloved mother. Thank you. Yes, madam, you can go ahead with your presentation.
Thank you. First of all, I would like to thank the organizers of IFPH talks, especially Dr. Midul Sani sir and Dr. Dhanesh sir, for giving me this opportunity on this precious platform. Today's topic is liver and biliary disease and homeopathy, and I am Dr. POONAM CHABLANI from Delhi. To start with every presentation, we start with a disclaimer. Today's presentation at IFPH talk is on liver and biliary disease and homeopathy. It is only for the educational purpose on this public platform, and it is not intended to diagnose or treat the disease. Listeners will definitely be benefited from it. So it is only for the educational purpose. Today's topic, liver and biliary disease and homeopathy. And today's agenda, we will be discussing liver and biliary tract. We will talk about the functions of liver, common liver diseases, the types of liver diseases, causes of liver diseases, signs and symptoms, and investigations to be done. Then we will talk about the common gallbladder diseases or biliary diseases and the types of it, causes, signs and symptoms, and investigations. Next, we will talk about tips to prevent fatty liver, lifestyle management, and then we'll talk about what foods protect our liver. And because it's a homeopathic platform, we'll talk about the homeopathic management of cases also. And then summary. You can see the slide. In this slide, you can see it's a picture of liver and biliary tract. Liver is a very important organ. It is located in the right side of the abdomen, just close to the rib cage. And its weight is approximately 1.5 kg. It is of the size of a football. It is the second largest organ of the body. First is the skin, second is the liver, and third is the brain. It is also known as a metabolic factory of the body as it controls all the metabolism. It is also a master regulator of the body as it regulates and tolerates all the irregularities in your lifestyle for many, many years. And if it is not taken care of, your lifestyle is still faulty, it will lead to fatty liver disease and progresses to non-alcoholic fatty liver disease, to cirrhosis, and to hepatic carcinoma. Liver produces bile, and that bile is stored in the gallbladder, you can see here, and it is further transported to small intestine. This is the passage of the bile, produced in liver, stored in gallbladder, and transported to the small intestine. And bile helps in digestion and breaks fats into fatty acids. Bile helps in the absorption of fats and fat-soluble vitamins, especially vitamin A and vitamin D in the small intestine. Bile helps in the excretion of waste products and toxins from the body, from the liver, in the form of bilirubin and bile salts. There are two unique things that you will be interested for. Liver has two unique features. First, it has a dual blood supply from two things. First supply is from the hepatic artery that carries oxygenated blood from the circulation. And second blood supply is from the hepatic portal vein. It gets the deoxygenated blood from the small intestine that contain nutrients. So two supply. No other organ has a dual supply. This dual supply protects the liver. One supply is damaged, so it will start, if one supply is damaged, the other supply will continue giving the nutrition to the liver. So the liver has a constant 24/7 blood supply and it will work without fail. Second unique feature that you will remember, it is the only organ in the body that has a power to regenerate. If you give 40% of the liver or live donor transplant, you can always give it and it will again regenerate in both the donor and the recipient. So two main unique features. First is the dual blood supply that no organ has, and the other is the power of regeneration that no other organ has. Then coming to the biliary tract, you can see it is a network of 3 ducts and 3 organs. Organs are gallbladder, pancreas, and the beginning of intestine is the duodenum. And the ducts, 3 ducts are common hepatic duct from liver, cystic duct from the gallbladder, and common bile duct when both the ducts join together. Then we'll start functions of liver. There are main 4 functions of the liver. Like we said, it's a metabolic factory of the body. So it takes care of metabolism of carbohydrates, proteins, and fats. It is responsible for the protein synthesis, especially albumin, globulin, coagulation factors, complement factors, haptoglobulin, ceruloplasmin, transferrin, protease inhibitors, and cholesterol. Coagulation factors, it helps in the clotting. Then it is responsible for the storage of iron, storage of copper, and storage of vitamins, especially vitamin A, D, and B12. Fourth function is it is responsible for the excretion of bile salts and bilirubin. In addition, the liver cleans the blood, produces RBC, clotting factors, it maintains the blood sugar levels, and it regulates hormones. So all the functions are very important. It's taken care of by liver. World Liver Day, 19th April. Every year it is celebrated. There are 4 main symptoms. Jaundice, that is yellowness of the eyes, conjunctiva, yellowness of the skin, and the yellow urine. And then the clay-colored stool. Second is nausea vomiting, persistent nausea vomiting. The person will not be able to eat because of the liver problem. Third is the extreme fatigue and weakness and weight loss. Fourth will be the pain. Right upper quadrant abdominal pain is a very typical. So we have covered functions, 4 functions of the liver and 4 symptoms of the liver. Then the signs of the disease, of the chronic liver disease. What will we see in the chronic liver disease? What is visible signs? Hepatomegaly, that is enlargement of the liver. You can see the abdomen is distended. Ascites is there, the fluid is there. Cirrhosis is the shrinkage of the liver because of the chronic problem. Caput medusae, the dilated veins around the umbilicus due to the portal hypertension. Then you can see the gynecomastia, that is a female type breast in the males because of impaired circulation of estrogen. Icterus, like jaundice, we have seen the yellowness of the eye. It is increased bilirubin due to the obstruction of bilirubin mechanism. Then palmariremia is the redness of the palms, impaired breakdown of the sex hormones. Spiderevia is the blue spots. It looks like a spider web. Isolated telangiectasis. Ecchymosis are the blue spots. Defective coagulation problems. Then there are the nail changes, leukonychia, because of the hypoalbuminemia. And sometimes you must have about the terry nails. That is again the ground glass appearance of the nails and the whiteness of the nails because of the liver condition, chronic liver condition. Then you can see the finger clubbing, spoon-shaped nails, hysteresis, abnormal movements due to the faulty metabolism. Then there can be feet factor hepaticus. characteristic order, particular order due to the volatile aromatic compounds. These are the signs. Then common liver disease. We will discuss about the 11 common diseases. First is the hepatitis, that is the most common form of the liver disease. We'll discuss in detail. Second is the alcoholic liver disease. It can be acute, like acute toxicity can be there of the alcohol, and it can be chronic alcohol consumption leading to the cirrhosis. Third will be the fatty liver disease. We'll talk in detail because it comes in the lifestyle disorders. Fourth will be the non-alcoholic fatty liver disease. And its old name, new name is metabolic dysfunction associated fatty liver disease, and comprises of three main metabolic disorders like obesity, diabetes, and hyperlipidemia. We'll discuss in detail about it also. Then comes the cirrhosis, that is shrinkage of the liver. Then we'll discuss about the liver cancer. There are two types of liver cancers, benign and malignant. Benign includes adenoma, angioma, nodular hyperplasia. Malignant cancers are hepatocellular carcinoma, cholangiocarcinoma, hepatoblastoma, and angiosarcoma. Then we'll discuss about the autoimmune hepatitis due to immune dysregulation. As the name suggests, it is the immune system attacks the body, healthy liver cells, and causes inflammation. So it damages liver cells. This immune system is responsive. Bad immune system is responsible for it. Then comes eighth is the congenital disorders. Wilson's disease is an excess copper deposition in the liver, and you can see in the form of the copper ring around the eye. Then hemochromatosis, that is excess of iron deposition in the liver. That is also not good. Then we'll talk about the cyst, simple and hydrated cyst. Liver failure can be acute and chronic. And 11th is the acute liver vascular disease. We'll talk only few diseases in detail, that is hepatitis, alcoholic liver disease, fatty liver disease, and NAFLD. Hepatitis. Two types of hepatitis, infectious and non-infectious. Infectious can be again divided into three: viral, bacterial, and parasitic, and helminthic. Viral include hepatitis A, B, C, D, and E. We'll discuss further. In bacterial, hepatitis includes Salmonella typhi, staphylococcal infection, leptospirosis, and syphilis. In parasitic and helminthic type, there can be amoebiasis and toxoplasmosis. In non-infectious hepatitis, there are again divided into three: toxic because of the alcohol. Second is medicinal causes because of the excess use of drugs, and herbal supplements can also cause hepatitis. And third will be the chemicals. Anything that is more of the chemical type can harm the liver. Then gallstones, chronic gallstones can cause hepatitis when they are obstructing. Then ischemic hepatitis. Viral hepatitis. What are the common signs and symptoms? It's the same like we discussed about the liver problems, liver signs. There can be fever, there can be fatigue, there can be loss of appetite. Patient can complain of nausea, vomiting, dark urine, clay-colored stool, pruritus, that is itching of the skin. And sometimes there can be no symptom, asymptomatic. Then the transmission. The viral hepatitis A and E is transmitted through fecal-oral transmission, close contact with the infected person. And the treatment is, the symptoms are like food poisoning, just manage the symptoms if it goes away. Then hepatitis B, C, D, the transmission is through the blood or body fluids. Sharing needles, personal items, unprotected sex in pregnancy, it is contagious, and it can be due to infected blood transfusion also. and hepatitis B is a chronic problem. How to diagnose it? Through medical history, physical examination that you do, the blood test. In blood test, that there will be deranged LFT, liver function test, and the ultrasound can be done to see the grading. FibroScan can be done to see the elasticity. Then endoscopy in further cases, and in some cases, liver biopsy is also needed. What is the treatment of the hepatitis? It depends on the type of the hepatitis, if it is acute or chronic. And acute means problem is less than 6 months. In chronic, the problem is more than 6 months. In acute, the symptoms can be the same: nausea, vomiting, right upper quadrant pain. And how it will, so there will be increase of the bilirubin. Yellow pigment will be increased. You can see in the form of jaundice, pruritus, dark urine, and clay-colored stool. And there can be hepatomegaly, enlargement of the liver. In chronic, because it is more than 6 months, it is throughout there. You can, there may be symptoms and there may not be any symptoms. It is asymptomatic. The symptoms can be the same, like fever, fatigue, loss of appetite. The patient is not able to eat anything. Then other symptoms, extra hepatic, other than the liver symptoms can appear, like arthralgia, joint pains, and skin rashes can be seen in the chronic thing. Then the treatment depends on the reason of hepatitis. What is the reason of it? We have to find out. It is the fecal, the diet, it is through the food, or it is the blood transfusion. We have to find out the virus involved in it, the stage in which it is it, and any complication we have to take care of. Then acute hepatitis, the treatment is, we say treatment is bed rest, plenty of fluids, water, glucose, whatever we give it, a good balanced diet, symptomatic medication, and hospitalization in few cases only. It gets treated itself. The symptoms are just like a food poisoning and they will manage in few days. In chronic hepatitis, because the symptoms are chronic, the problem is persistent, antiviral drugs have to be given as per the doctor. The complications of the hepatitis, in hepatitis B, because it's a chronic infection, it can lead to the damage of the liver, cirrhosis, that is shrinkage of the liver, cancer of the liver failure that needs a transplant, and it can also lead to kidney disease and death. These are all the complications. How to prevent it? Just good hygiene and nutrition is important, and safe drinking water to prevent hepatitis A and E. And watch for the blood transfusion, IV fluids, injections, drug abuses, avoid tattoos, unhealthy sex practices, especially for the hepatitis B. Vaccines are available for hepatitis A and B, and the doses are 3 doses on 0, 1, and 6. 0 and 1 month and 6 months. Second, we will discuss about the alcoholic liver disease. As the name suggests, it is because of the chronic intake of the alcohol. It can be 4+ drinks per day that leads to the inflammation of the liver and cell death and further shrinkage of the liver. There are 3 types of alcoholic liver disease. First is alcoholic hepatitis. Itis is the inflammation of the liver. Steatosis is the fat deposition because of the chronic use of the alcohol. And third is the chronic hepatitis cirrhosis. That is because of the excessive alcohol intake and the fatty deposition. In chronic conditions, the liver shrinks and stops its function. And it will be taken care of only by transplant. It needs a transplant. Then we'll discuss about the fatty liver. When to suspect fatty liver? When there is pain in the abdomen, 40% cases, fatigue, extreme fatigue, tiredness in 40%. There are the gastric symptoms like acidity, bloating, burping, digestive symptoms are there in 30% cases. Then because of the acidity, there can be upper reflex also. The snoring, 20% cases. then there can be high cholesterol, high sugar, high uric acid, and deranged LFT, liver function test, in 30% of cases. And in some patients, there can be no symptom also in 40%. Of fatty liver, there are few tests that we recommend. You can test it yourself also, that is called self-test for your family and self. And the other are the simple test that has to be done by lab. The self-test, how to find out that you have anybody has a fatty liver. Check out for the obesity, the waist, abdomen, the waist size. Check out for the obesity, check out for the diabetes, blood pressure, any heart problem, any kidney or liver disease, or cancer, or PCOD, polycystic ovarian disease. If you have this thing, it is just because of the liver problem. Then, for everybody, what should be the ideal weight? Ideal weight is equal to height in centimeters minus 100. In the male, if the height is 170 centimeters minus 100, the weight should be 70 kgs. In the same way, if the females of the same type, they should be having 5 kgs less, 65 kgs. If there is a family history of anything of diabetes or blood pressure or obesity, then 5 to 10% more is required. You have to reduce more 5 to 10%. If one parent has a diabetes, then 5% less. If both parents have diabetes, then reduce weight by 10%. And you can see the diagram on the other side, the self-test. Waist in males should be less than 90 centimeters. In females, it should be less than 80 centimeters. Check for it. You can teach the tailors, teach the children, parents, and check for fatty liver and treat properly at the proper time. The other self-test is for the neckline. Check for the black velvety lines at neck. There can be warts, moles, and these black lines are called acanthosis nigricans. You can tell the barber to watch for it or tell anybody to see. This shows the fatty liver starting is there. Other simple tests. These are the self-tests. You can do it yourself. Simple tests to be done by the lab. That is a blood test. SGOT, SGPT will be more than 40. High lipids and sugar high can be there. Second can be the ultrasound abdomen. It will show the grading, grade 1, 2, 3, fatty liver. And then third will be the fibroscan to show the elasticity or rigidity of the liver, how the liver is functioning. There are 3 types of people. Those who are lean, thin, normal, with a BMI less than 23. Those people who are overweight, obese, with a BMI, that is a body mass index, more than 23. And the third people who have the body mass index more than 23 with the diabetes. Check for waist. If it is 2 plus, that means you have a fatty liver. Reduce waist and you will feel better. You can reverse fatty liver. Check for the BP. It should not be more than 130/85. The triglycerides, if it is more than 150, then the fatty liver is there. HDL, if it is less than 40, then fatty liver is there. HbA1c for the diabetes, it should be 5.7 to 6.4. It should not be more than that. If it is that, it detects 5.7 to 6.4 shows the fatty liver. It should be a normal HbA1c is less than 5.7, but 5.7 to 6.4 is the fatty liver. Then the family history can be also there. If your parents are diabetic or having the blood pressure, you may also have that thing. If they have the fatty liver, you can also have the fatty liver. All these tests, self-test and simple test, if you detect the fatty liver, then manage and reverse the fatty liver accordingly. Then you can see in the diagram, the fatty liver progresses to NAFLD. NAFLD is non-alcoholic fatty liver disease. It's the old name, and the new name is metabolic dysfunction associated fatty liver disease. and it comprises of 3 metabolic disorders. You can see in the diagram below that NAFLD, non-alcoholic fatty liver disease, in the fatty liver, it is increased ALT, increased SGOPT, and it can lead to 3 metabolic problems. The fatty liver can lead to 3 metabolic problems: obesity, diabetes, and high lipids, hyperlipidemia. Obesity because of the overeating or inactivity. Diabetes because of the adipose tissue, hypertrophy and inflammation. And hyperlipidemia can have increased TG, triglycerides, free fatty acids, increased glucose, increased insulin, increase of E-selectin, increase of C-reactive protein, increase of leptin, and decrease of adiponectin. All this fat in the liver is bad, and it can be from the genes, from the bad genes from the parents because they have the diabetes, blood pressure, the cancer, or it can be due to the irregular faulty lifestyle leading to fatty liver, and further it can have hypertension, and there can be endothelial vascular dysfunction and leading to the heart disease. Again, in the diagram, you can see a bullock cart. Pink is a normal liver, and the yellow one above is the fatty liver. It is dragging the fatty person. Then progression from fatty liver to non-alcoholic fatty liver to fibrosis to cirrhosis and hepatocellular carcinoma. 1, 2, 3 can be reversed through diet, exercise, through weight loss and medicines. There are many risk factors, but normally you can see the healthy liver, the risk factors are 5. If there you have an irregular diet, then excessive consumption of alcohol can lead to the damage the healthy liver, viral hepatitis, obesity, and many drugs, even the paracetamol and many other drugs also harm the liver. Whatever medications you say, everybody damages the liver. If you, there are other risk factors like adipose tissue dysfunction, altered energy hemostasis, diet and nutrition, environmental factors, epigenetic factors, genetic factors, the gut microbiota, insulin resistance, and sedentary behavior. If you are not taking care of it, the liver, the healthy liver consists of 5% fat. Fat is 5% in a normal healthy liver. But if you don't take care of the liver with the irregular diet, alcohol, viral hepatitis, the fat increases in the liver. And if it is more than 5% fat in the hepatocytes, that is steatosis, that is fatty liver. If you take care, it is reversible. If you don't take care, it will lead further to the fibrosis, that is inflammation, steatosis, NASH, non-alcoholic fatty liver disease. Here also it is reversible if you take care of yourself. But if you don't take care, it will further progress to cirrhosis, that is shrinkage of liver, and hepatocellular carcinoma. And there is no treatment for it. It's not reversible. Only liver transplant is there, and it can lead to death also. Then we will discuss about non-alcoholic fatty liver or NASH. As you can see, 1 in 3 people in India have NAFLD with increased SGOPT, and there can be high inflammation. Liver is the core for all non-communicable diseases, especially type 2 diabetes, hypertension, cardiovascular diseases like MI, peripheral vascular diseases, DVT, then stroke, and non-alcoholic fatty liver, PCOD, sleep apnea, you are opening your mouth and sleeping, excessive fatigue. Then you can also have cancer of breast, prostate, colorectal, and liver. What is the solution? check out what you eat and when you eat. If you correct it, all these diseases can be corrected. Liver failure, again, it needs the transplant, acute and chronic. Acute can be because of the excessive medication, hepatitis, acute Budd-Chiari syndrome, that is the clot. It's not responding to the therapy. Metabolic diseases like Wilson's disease, excess of copper deposition in the liver. Chronic failure can be because of the hepatitis B, C, alcohol-related hepatocellular carcinoma, sclerosing fibrosis of cholangitis, biliary cirrhosis, autoimmune diseases, hematochromatosis, familial amyloidosis, polycystic liver disease, and recurrent cholangitis, inflammation of bile duct, recurrent. We have covered common liver diseases. Now we'll come to common biliary diseases in short. There are main three types of, like in the diagram you can see, acute cholecystitis, ascending cholangitis, and choledocholithiasis. First, biliary disease, we can discuss. We have divided the biliary diseases into 5 types. Cholelithiasis, gallstones, as we all know. There 80% gallstones are yellow because they are found because of the cholesterol, and 10% gallstones are black because of the hemolysis. 10% gallstones are brown because of the bacterial infections. And the gallstones are common in 6F, this short form, common in female, fat, 40, fertile, in the fair female, and who has the family history. In the diagram, you can see the symptoms of the gallstone. There can be fever, jaundice, right upper quadrant pain, and all these 3 symptoms are called Charcot's triad in the gallstone disease. Then second comes the cholecystitis. That is, itis means the inflammation of the gallbladder. It can be because of the gallstone also. Then we have choledocholithiasis, that is stone formation in the bile duct, and ascending cholangitis is inflammation in the common hepatic duct above, coming from the liver. Then there can be cancer of the gallbladder and cancer of the bile duct, and there can be biliary obstruction because of the gallstone. Then cholecystitis. What are the causes of cholecystitis? 3 main causes. It can be gallstone, it can be the tumors, it can be the prolonged fasting if you are doing it. So the contraction will be not in time. The symptoms of the cholecystitis, the inflammation, are nausea, vomiting that can be corrected by the IV fluids. The gallstone in the duct can get infected and cause empyema, that is the pus in the gallstone, in the gallbladder. And there can be pain in the right upper quadrant that is radiated to the shoulder tip. That is a Murphy's sign. And the investigations to be done for the cholecystitis are, it can be diagnosed through ultrasound and MRCP, that is magnetic resonance cholangiopancreatography. Biliary diseases, the causes, there can be 2 main causes of the biliary disease. That first is impaired gallbladder function. There can be impaired emptying, absorption, and excretion. Second is supersaturated bile, that is thick bile because of the age, sex, genetics, obesity, and diet. And it can be diagnosed through 3 things: by CBC, complete blood count. You can see the increase in WBC. It can be in cholecystitis, ascending cholangitis. Second can be liver function test, can be deranged, increased bilirubin, SGOT, SGPT, and right upper quadrant ultrasound also diagnosis. Then treatment of cholelithiasis is to decrease gallstone formation and preventing obstruction cholelithiasis. Cholecystitis, and because there is inflammation, remove the infected gallbladder stone. In critical ill cases, the bile can be also removed. and changed. Cholelocholithiasis and ascending cholangitis, again, the itis is there and inflammation is there. So they can, you can remove the you can remove the bile stone through ERCP, that is endoscopic retrograde cholangiopancreatography. You can see these are the ultrasounds. First is the gallstone, cholelithiasis, you can see the stone. And in second case can be cholecystitis, the gallstone is there, and Murphy's sign is positive in ultrasound. You can see this thing. Murphy's sign is positive. There can be gallbladder thickening, and pericholecystic fluid is positive. Around the gallbladder, there is fluid. It in right upper quadrant is this ultrasound is inconclusive. You cannot find it in ultrasound, so HIDA scan is required. HIDA scan is again, you can see here. In the third case also, CBD stone is there. There's a common stone is there in the bile duct, and there is a dilated bile duct. It can be seen in cholelocholithiasis and ascending cholangitis. HIDA scan can be done. HIDA scan is hepatobiliary immunodiastatic acid, and the radioactive tracer material is injected into the arm in the vein. And scan is studied in the image is taken and studied in the computer and it shows the track that bile follows from liver to small intestine. The management of fatty liver disease. You can remember a short formula, new start. N is the nutrition. You can remember N for the nutrition, E for the exercise, W for weight control and water, S for sleep, sunlight, stress management, avoid sedentary lifestyle, T for temper, that is anger management has to be done, A for avoid. What you have to avoid is alcohol, tobacco, smoking, stress, medicines like antibiotics and painkillers. Relax, R for relax and regular checkups. T for take care of your body, maintain personal hygiene. And these are the same things. And nutrition, you have like the earlier lecture, Dr. Kajal spoke about diabetes and the diet in detail. It's the same thing. You have what you have to consume is the 3 F's: food, fish, and fiber. Foods, fruits, all vegetables, all fruits. In vegetables, all colored vegetables. In fruits, like apple, berries, that are having antioxidants. In spices and herbs, that have good anti-inflammatory properties, especially turmeric, that is haldi. Then you can have tulsi, ginger, garlic. Then green tea is also good. Coffee is good thing. Whole foods are there like millets. Kala chana can be taken. In fish, you have omega-3 fatty acids are there. In fiber, chia seeds and flax seeds. And olive oil contains monounsaturated fatty acids and polyunsaturated fatty acids. And you can have nuts and seeds, especially walnuts and almonds, in moderation because they are high in calories, but they are good source of vitamins, selenium, zinc, and they have a high HDL and low LDL and low triglycerides. Then what to avoid? Avoid processed foods, meats, high saturated fats, refined carbs, fruit juices, and all O's, fructose, sucrose, maltose, and potatoes. There's a just the in short, what Dr. Kajal also told, that what you have to consume the foods that have anti-inflammatory properties, they have antioxidants, they are having low glycemic index so that they can control the blood sugar spikes. And at least they're healthy for your thing. and eat a balanced diet, and you can maintain a healthy weight with it. With the card, you can see the diagrams. Limit intake of saturated fats and trans fats. Eat a balanced diet. Limit consumption of refined carbs, that is breads. Maintain a healthy weight. Check it every week. Quit smoking and alcohol. Exercise regularly. Exercise regularly, especially the aerobics and the exercise for the muscle resistant exercises. Take medicines as prescribed and avoid over medication. This is the video. I can think we can show it afterwards. Last two slides are very important because we are covering homeopathic management here. I am covering homeopathic management with two cases. First case is the case of chronic constipation. This case was referred to me by some other patient. There's a 3-year-old child. She was given laxatives and enema since 9 months of age. She had to be given laxative every 2 to 3 days. And she had complained of pain and there was blood in the stools. The mother told all this thing to me when she called me up. And she was taking these laxatives from a she was consulting gastroenterologist since all these years. The doctor told that you have to give the laxatives. You don't have to stop it. When I inquired about this case, because she was on heavy medication, heavy laxatives, and still she was not able to pass the stool. And then I inquired the case in detail and asked about the appetite and the thirst. She was not able to eat properly. She was not drinking properly. She was taking the water in sips. She was irritable. She was underweight. In this case, when I inquired more and more, I thought I cannot stop the laxatives immediately. So slowly we will taper it down. And I took the whole case in it. I'm giving you in the short only. I advised the mother to give the child water. Increase the water intake of the child and be conscious how much she is drinking. Give it not in the sips, just see how much what the glass she is consuming. And for the homeopathic medication, I gave at that time, because for abuse of laxatives, Nux vomica in various potencies, and I gave liver tonic for chronic constipation. Both the medications were given at least for 1 to 2 months on and off. Liver tonic is good for the liver problems and treats constipation. And after 1 to 2 months, the patient improved and she was not taking any more laxatives, allopathic laxatives, and even no homeopathic medicine also. She is doing very well without medication. The second case is again a diagnosed case of acute infective enteritis. It's a question mark, and dyspepsia. In this, a 30-year-old patient came to me and he was taking treatment since 9 months from a reputed hospital for stomach upset, reduced appetite, nausea, vomiting, weight loss, extreme weakness, and there was a pain, constant dull pain in the right side of the abdomen radiating to the shoulder, the typical Murphy sign. Because the gastroenterologist was taken care of, and all the 9 months the patient was not feeling good, so he consulted me for the homeopathic thing also. To me, when I took the case, I could see the symptoms of jaundice. No appetite, nausea, vomiting. The patient was not able to eat anything. Weight loss was there. The weakness was there. Constant dull pain in the right side abdomen was there. So I got LFT done. It was deranged. and in ultrasound, fatty liver grade 2 was found. With homeopathic treatment, LFT came normal, and ultrasound fatty liver from grade 2 reversed to grade 1. And in the course of the treatment, I think I have given the medicine for jaundice. I thought the liver tonic, I gave Jondilam. The other medicines I gave Brinia, Chelidonium, Nux, arsenic in due course of time. The appetite improved when the patient was not able to eat anything. With all this medication, patient was able to eat 3 chapatis and the weight was stable. It was not gaining, but at least the weakness is better. The weight was stable and the medicines were given on the SOS basis only. This is also a very important slide. Summary. First, prevention is better than cure. Liver is the core of all non-communicable diseases. For example, diabetes type 2, hypertension, cardiovascular diseases, myocardial infarction, peripheral vascular diseases like DVT, stroke, NAFLD, polycystic ovarian disease, sleep apnea, cancers like breast cancer, prostate cancer, colorectal cancer, and liver cancer. All these things can be prevented at early stage. So it can be prevented and treated if we detect it early and treat early and effectively through lifestyle management. In both the cases, I did lifestyle management with the homeopathy treatment. The purpose of this lecture is to create awareness, educate, and to empower people to lead the healthy life and take care of the liver. Third important thing is what to eat, when you eat, and what quantity to eat. You have to check for it. And reduce calorie intake, increase your physical exercise that will burn the fat, reduce weight as per the actual BMI. Fourth is the homeopathic treatment. Homeopathic treatment is a scientific system of medicine. It is a very effective, cost-effective, safe, no side effects in liver and biliary diseases, especially jaundice, fatty liver disease, non-alcoholic fatty liver disease, in cholelithiasis, in post-gallbladder surgical cases, promotes healing. Where lifestyle and diet modification is a first-line treatment, it plays a very important role and helps in the reversal from unhealthy to healthy liver. In homeopathy, it is based on principle of two major principles, principle of individualization and holistic approach, where we select the right medicine on the basis of totality of the symptoms, and it is not just diagnosed on the name of the disease. We treat the underlying cause, root cause of the disease, and treat accordingly. In homeopathy, we take detailed history taking, physical examination, investigations are done, and in all signs and symptoms, we give more importance to the mental symptoms also, how the patient is thinking, feeling, and behaving. We take care of the underlying stress, emotions, ailments from grief, etc. Seek professional help when needed. Keep yourself updated with the knowledge from reliable resources. More research and documentation is needed, as Dr. Mridul Sani sir said today. Collaboration between the homeopathic practitioners and mainstream mental health professionals should be promoted in the upcoming years. Thank you. Thank you for your patient listening.
And thank you, Dr. POONAM CHABLANI. It's really a very good session. You covered almost all part of these liver and biliary problems. And as you all know that this is a big subject, but we have to cut short in this thing to a capsule so that we have to cover this same in 1 hour. That may be the reason why we could not go into depth of the liver problems. But of course, everything you narrated, the causes behind the illness and how it can be managed, what are the examinations to be done, what are the things to be avoided, what are the things to be looked into, what is the importance of exercise, and how what is the importance of real lifestyle correct clearance, and all those things need to be very beautifully narrated. Anyway, congratulations for the same. And the only two, or even though you presented only two cases, that's also very important that we homeopathic doctors nowadays get a lot of biliary tract obstruction due to these polycystic stones, biliary stones that may produce polylithiasis like problems. And our medicines are excellent. And of course, food apple can do a lot of good thing for that also. Anyway, one more thing I would like to add that all these liver problems we cannot ignore, because we know that most of the people are addicted to the modern system of medicine, and those medicines they are taking are also doing a lot of harm. As you know, that it is liver is the factory where everything being synthesized or metabolism is done in a beautiful way. But when the chemicals are added to a lot of chemicals are coming into the liver, naturally the liver itself will get damaged, and that is also one of the reasons why some of the autoimmune diseases happens into some of the patients who are taking constantly lot of allopathic medicines. I have seen such cases before. I have seen a patient who was taking more than 33 tablets every day, and he was suffering a lot of these problems. Anyway, we as homeopaths can manage this with our homeopathic medicine, and only very rare times we have to refer the patient for this. When it happens like this liver cirrhosis or something like that, then we will have to sometimes the patient may have to transplant the liver, but we can avoid transplant in the liver by means of our homeopathic medicines if treated properly. And there is a thing, a common belief that alcohol is the worst thing that make all these troubles. No, frankly, we can see lot of women nowadays suffering from these liver problems because most those people who suffer from this liver problem, when we enter into the patient, we can find that the mental symptoms, mental problems or stress, those are the things that may aggravate their condition and may be the precipitating factor behind this illness. What is your opinion on that, doctor?
Sir?
What's your opinion on that?
Yes, I fully agree with you. I have got a video also, just for 1 minute. If we have time, can I show it?
No, we have very little time.
Just 1 minute. It's 1 minute only.
Yes, you may go.
It's a very informative video, sir.
Yes, yes, that itself shows how important the food and everything for protecting the liver. Anyway, that's a very good sign also. So we can go to the last part of our session. That is vote of thanks. I invite Dr. Ramprasad to say vote of thanks to this session.
Thank you, Dr. Dhanesh ji. Congratulations, Dr. Poonam Madam. Very nice presentation. Excellent session. Liver diseases, cause and treatment. What you eat, and when you eat, and what quantity. Very good advice. There are many angles of treatment. Angle, symptomological angle, mathematical angle, and your treatment is pathological angle. It's a very difficult treatment. Liver disease treatment, main cause of anger and emotional and diet and lifestyle. So very, very thanks. Behalf of IFPH, very, very thanks, Poonam Madam. Again, presentation, IFPH. Thank you. Very, very thanks.
Thank you, Dr. Ramprasad, sir. It's the time of the session. So before that, tomorrow we will have a session from Dr. Shalini, and Dr. will be talking about rabies and its homeopathy treatment. Thank you, Dr. Poonam Chablani, and those who participated in this session.
Thank you.
Thank you.
Thank you so
Thank you.
much.
Thank you.
Kind words.
Very, very thanks.
Thank you all. And we'll see you tomorrow at the same. So over to Dr. P. to moderate the Malayalam